Inflammation. What are leukocytes? Leukocytes are big in the discussion of inflammation. There are many different types of leukocytes. Leukocytes are white blood cells. That's the major name for all of this group. And they include neutrophils, or polymorphonucleocytes, macrophages, mast cells, basophils, and the T and B lymphocytes, which play a big part in immunity. They're actually white blood cells. Well, how do they primarily function? They function by phagocytosis. They engulf and digest impaired tissue. Why don't they attack healthy tissue? Well, they might, so they need to be regulated by inhibitors such as the cytokines. Now, box 3.1 on page 43 in your book is a nice box. Please review that. After tissue injury, vasoactive chemical mediators bind to receptors on endothelial cells and vasodilate or widen the blood vessel to allow an increased blood flow to the site. It's injured. We need the blood to get there and get there as fast as possible to help heal. So there's a vasodilation. There's increased vascular permeability, which lets the blood and the blood products that are needed seep out of the blood vessels and get to the site of the injury. There's also a clotting cascade, so that we have some clotting going on. We don't bleed to death. The harmful cells are destroyed. That's called cell lysis. And there are other vasoactive mediators that are produced. Now, lymph and blood vessels, let's talk a little structure here. The very outside of those vessels is called a basement membrane, and its job is just to keep everything together, just hold it all intact. But immediately on the inside of that basement membrane is a layer of endothelial cells. And it's the endothelial cells and the basement membrane that actually loosen up a little bit to let the white blood cells and the plasma and the clotting factors, whatever is needed, lets that seep out to get to the injured tissues. All right, let's look at injury specifically. Injury causes inflammation. There's an increase in vasodilation. There's a vasopermeability. Those two we've already talked about. There's also chemotaxis, and there's removal of injured tissues, and there's a preparation for healing. And we're going to talk about this last one in one of the next videos a little bit more. First, we get the vascular response. The cell is damaged. Healing products need to get in to the damaged cells. And damaged products need to get out. They need to get taken away and removed from the body. So within the blood vessels, like we've just said, we open the doors. We have that increased vascular permeability that loosen the basement and endothelial layers to let the good stuff out of the blood vessels to get to the damaged tissue. Now, the increased vascular permeability also dilates. There's also a dilation of vessels, so the cells can get there faster. If you have a very narrow roadway or a very narrow vessel, only a few cars or only a few cells can get there at a time. But if you widen the road, more things can get to where you want them in a quicker period of time. Also, along with this vasodilation, that allows an increased fluid to the area to dilute the harmful toxins, so you don't have quite as concentrated response. Okay, the next thing that happens is a cellular response. This happens in the blood or the lymph vessels. And again, we've got chemotaxis, cellular adhesion, and cellular migration. These are the three parts to the cellular response. Chemotaxis. The chemical mediators call to the leukocytes. They say, come to the site of the injury. We need you to come and help heal. Remember, this is happening inside the blood or the lymph vessels. So they travel through the blood to get near the injury, and then with the vasodilation and permeability, they leak through and get to the site of the injury. Cellular adherence. Well, the leukocytes get drawn to the site, near the site of the injury, and then they stick to the vessels. And if you injure your arm, the leukocytes are going to adhere to the blood vessels near the site of the injury on your arm and then leak through to get to the site of the injury. Then there's cellular migration, which is the actual leukocytes moving through that endothelial membrane to get out of the vessels to get to the site of the injury. Okay, so we've done chemotaxis, cellular adhesion or adherence, and cellular migration. All this moves the white blood cells or the leukocytes out of the vessels toward the site of injury, where then the white blood cells participate in phagocytosis, or engulfing and digesting the invading or the harmful harmful microbes. Okay, what happens when we have inflammation? What are the cardinal signs? I'm sure you've all experienced this before. We've got redness, heat, incapacitation, pain, and then we've got that oozing, exudates, and the edema, the swelling. Well, the first two, the redness and the heat, are a product of the vasodilation. We've got increased blood flow to the injured area. The incapacitation, that means you're losing function. And it's related to the tissue damage from the injury and from pain and from swelling at the site. The pain has a lot to do with the swelling, and also chemical moderators or mediators can directly elicit pain response. And finally, the exudates and edema are from the extracellular fluid that's accumulating in the tissue that is damaged or near it. And it's because of the vascular permeability. The stuff has come out of the blood vessels. The extra fluid has come to the site to help to heal it, but after a while it's too much. You have that edema and you have the exudates. Once the invaders are destroyed, the inflammation decreases. But we often have to treat inflammation. Why? Because inflammation is a very powerful reaction, and it usually reacts more powerfully than we need it. And if we don't do something about it, it may damage the surrounding tissues. So how do we treat it? We decrease the blood flow, we decrease the swelling, and we block the action of the chemical mediators. How do we do that? Well, this slide shows you stuff that shouldn't be a big news to most of you. You decrease the blood flow, use ice. Decrease the swelling, elevate the affected area. And then block the action of chemical mediators. Quite often we do that with drugs. ASA is aspirin. NSAIDs, that's non-steroidal anti-inflammatory drugs. That's things like ibuprofen. And then glucocorticoids. That's some of the steroids. You need a prescription for that. But isn't that typically what we do to treat inflammatory things? We put ice on it, we elevate it, and we take some aspirin or some ibuprofen.